My name is Dr. Seth Sherman. I'm Sports Medicine Fellowship Director and Associate Professor of Orthopedic Surgery at Stanford University. You are listening to Interview with a Surgeon with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Seth Sherman, Orthopedic Surgeon and Sports Medicine Fellowship Director at Stanford. Doc, how are we doing today?
I'm doing great. Really happy to be here, and thanks for the opportunity.
Our pleasure. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change during your fellowship?
Yeah, so I'm from New York City. I'm a third generation team physician and surgeon. My grandfather was a general surgeon, and my dad was a orthopedic sports doc in the local community in Staten Island. And so I always knew I wanted to be a doctor and a surgeon. Led me through med school in New York City and then to residency at a hospital for special surgery in New York. Going into that experience, I always kept an open mind. Just because my dad was a sports doc didn't mean I needed to be a sports doc. I certainly played athletics, basketball and soccer, and loved it. But I worked just as hard in cardiothoracic in med school, just as hard in plastic surgery or urology, giving the same effort and seeing if it jived with my personality and jived with what I wanted to do for Mondays for the rest of my life. And so they didn't. And I followed a natural pathway through my family into sports and then sports medicine. Talking about residency, I thought perhaps that I'd join my dad's private practice. Very well known in our community, and he had an excellent private practice. He also found opportunities to teach locally, things that I was interested in. But as time went on and as I learned about some of the other platforms and opportunities that can be open to you with a life in academics, things started to shift. For example, I saw mentors and how they not only gave it their all in their day job, but were able to travel regionally, nationally, internationally, both for team coverage and also to spread the message and to teach and to learn and to network. And so once you kind of get the bug about what questions should we be asking, what are the unknown in sports medicine, what can help my patient, but also help other doctors and other doctors' patients, how can we all make a difference? Those are the things that I think drive someone towards an academic career. And so as I went through residency and started asking those hard questions, it became clear to me academics was where I needed to go and wanted to go. And thus it led me to pursue a fellowship in sports medicine at Rush University in Chicago.
So during your fellowship, can you kind of take us through your mentality heading into your first job search and how that perspective changed in the beginning years of your career?
Yeah, so I think, again, just advice, hindsight's 2020. You wish you could go back and do it again. I should have thought more in residency about where I exactly wanted to be and what my exact goals were. You're always focused on today and tomorrow, doing a good job. And then if you're in med school, going to residency. If you're in residency, getting into fellowship. But I would encourage everyone just to think a little bit more broadly, to engage and enlist, their mentors earlier, and to have a vision and a mission and to try to stick to it. For example, I think that I started the search a bit late in the process. I really didn't even ask those questions to my dad and his practice, like the actual questions. What would it look like if I joined your practice from a financial perspective, from a day-to-day, from your hospital resources? I didn't really even engage my mentors at HSS, for example. What would it look like if I stayed here? Is there a place for me here? Those are hard questions for a young person to ask. I kind of let things naturally develop, and while they did, it could have been a broader search and perhaps led me in different directions. That said, there were excellent academic opportunities. I knew I wanted to be in academia, and so you really have to go where the opportunities are. And so for me, I wanted, my list included big team coverage. I wanted an academic center that had tertiary referrals because I was doing things like osteotomy and transplanting cartilage, things that don't happen in a regular bread and butter sports practice. So I had to go somewhere big with a catchment area. I wanted a place that had a clear goal and a vision and the desire to be great. And then I also needed to consider family issues in there. My wife was from the Midwest, even though I'm from New York City. That broadened my horizons to first my fellowship in Chicago, and then to perhaps staying where I wound up for the first 8 years of my career at University of Missouri. And so while if I made my list of job criteria or opportunities, the last one on that list, of course, since I have really no specific family in Missouri, was location. But sometimes when you're starting out your career and everything from the mentors there, the coverage, the research, the academia, the clinical experience, you have to make some sacrifices as long as your family is willing to support you through that. It's a journey, and it's really not about where you are initially. Actually, up to 50% of people in our field, I believe, change their jobs within those first couple of years. So really making sure that it moves the ball forward for what your eventual goals are. And for me, it certainly did that for my start of my career at Mizzou.
So throughout your career, did you ever consider going private practice, or were you academic focused all the way?
Yeah, I think, I certainly saw the benefits of private practice from my dad's experience. He was his own boss. He said when he can come and go, when he can go fishing during the week or, on the weekends, or go to New Zealand and trout fish. We're huge fishermen in our family. And so that kind of flexibility, he was always at all of our games. He coached our teams. So I think when you're looking at things like that, those are things that private practice model may afford you, in the right model, that kind of flexibility. He also, just to finish off that thought about private practice, was able to engage and to continue to be an educator, both to, let's say, the local med students, or sometimes residents or physician assistant students. And he was able to engage through international organizations such as the ACL Study Group, and also through, let's say, Arthroscopy Association and AOSSM, to keep that academic vibe. So I think there's certainly a role for private practice or privademics without losing a lot of that intellectual curiosity. That said, I think from what I described earlier, I just got the bug for academia. My mentors in my career from HSS, from Rush, and frankly from around the world, just were in positions where they could really help and influence the lives of those young learners. And I think, until you go through that process, you recognize the hardships, you get beaten down a little bit, you have some bad examples at the top that really frustrate you, you realize that there are more people out there who are advocates and who really want to support you, and you really have to cling to those guys. And right now I'm just so lucky as fellowship director at Stanford and surrounded by a great team that I get to do that for all of the young med students, residents, fellows, and frankly, any young faculty that come along. So it's kind of exciting to be able to give back like that now.
What were some of the keys to your success that shaped your early career as you climbed the ranks in the academic world?
Yeah, I think these things are so simple yet so hard. And I think that's what makes them great. The first one, I think any of us are type A and we're motivated, right? So you really need to, treat every day the Super Bowl. And I mean, you're just given maximal effort all the time. You're on all the time. And I think that that's something that we just get used to. But there's beyond all the time. And I think you clearly need to approach that, or at least I do, with enthusiasm. I want to be here. I want to be doing this. I'm present now. I'm not just doing it because I'm supposed to be doing it. And so I think that that's a huge thing for young people. And frankly, if you don't feel like you want to be there, putting your best face forward when you have to, and training to be present, because we all notice that no one wants people around for an 80-hour work week when they seem apathetic or disinterested. We see it, unfortunately, every month or two with different learners, and it's so avoidable. It's such a simple thing. Just be engaged and be present. I'd say other major things, humility is by far, the biggest thing. We are entitled to nothing. We are working for everything. I feel today so hungry for what the next steps are, and that I've accomplished, not that much yet, and that I have so much more to do. And I think that carrying that level of humility with you throughout this process is really important. I unfortunately see some young docs who go through, they think that they got through residency, they got through fellowship, now they're entitled to making X amount of money. They're entitled to this incredible practice. They're entitled to have these patients come to see them because they're so great. And it doesn't work like that. It actually, all that's erased, and now you're starting from the bottom and working yourself up. So I think you just train yourself to be like that. And then other things that come to mind for me are, clear communication. I think that, communicating with everybody is so important. You have great things to say, but if you can't articulate them and if you don't engage people, then they won't know about it. So that includes communicating with the younger people around you. That includes clear communication with your staff, clear communication with your patients. So I think, communication is critical. And lastly, I think engage your mentors and networking. I mean, that is such a powerful aspect of how we accelerate. I mean, every one of us have gotten above X threshold on a test. We've all jumped through the hoops of our training and our licensure. So what differentiates us from the others? And I think that it really is who you surround you about. If you want to be excellent, surround yourself by people who also want to be excellent, and don't be threatened by those people. Let them build you up and bring you up. So I found great mentors, some a little older, some a lot older, some local, some, for example, one of my best mentors is in New Zealand, and you don't know where they're going to be until you engage and enlist them. But once you learn what the characteristics are of being a good mentor, you can also kind of become that for others. And so it kind of comes full circle. And I think that all of those characteristics to me are what make great leaders, and frankly, what just make good and compassionate doctors.
What advice do you have for the graduating residents and fellows as they enter the job market for the first time?
Yeah, I think, it's obviously an intimidating market. It's interesting, as I saw and they will see, that, everybody wants to train you. But then when it comes down to you, posting up and setting up shop and doing what you've learned to do, maybe not in my backyard. And so, I think don't be discouraged by that. It's an unfortunate and natural tendency in any, field that the masses might be threatened by you. But that said, be confident and know value added, and if you go about it the right way, kind of with the principles that I just kind of laid out, I think you can make your foothold and start, slowly and grow up in any marketplace. So, I think that they should be willing to ask those hard questions. Is there availability for me here? It's not that everyone's going to jump out and be actively seeking you out. And then I think you have to be very flexible, and you have to make that list, and you have to see where your red lines are. And if you don't have those, red lines, then maybe that first job opportunity fills most of the boxes for you and your family, not all of them. But if you're patient and you work hard and you do the right thing every time, then I think those, those doors will open when the time's appropriate.
Now, a conversation that comes up a lot is the issue with all these meetings being virtual now, and that this graduating class doesn't have the ability to rub shoulders with someone like yourself at these annual meetings. What advice do you have for them for their network outreach process?
Yeah, I think the good news, as we're showing right here, is that we're all getting very comfortable and confident with a variety of different platforms, including Zoom. And so just by nature of the pandemic, we are able to actually interact and engage. I mean, we're having a very meaningful conversation. I'm getting to know you, you're getting to know me, and we've never seen each other. So these things can happen. Able to engage and personally on webinars like I might do later for a couple hundred people, or that I've done across the world for a couple of thousand, and it feels relatively intimate. So I think it can be done. We just have to, again, be flexible. I think that unfortunately they have to be aware of what's in their background, where they are, what their lighting is, what their appearance is. I mean, we just can't take all the social cues that we're normally able to take. So you have to, do a little legwork and maybe background, reading and understanding of what sticks out in the virtual world. I mean, I think that's just good business, just like you would do for any in-person interview. You have to do it, virtually. And I think that, those who struggle with some interpersonal communication or relationships or those issues need to practice and should practice on their friends, their family members, should make eye contact, should engage, should sit up, right, and be present. And I just feel like those are important cues, because the last thing any of us, it's hard enough when you have a drawn out, and boring, apathetic, interview process in person. At least you're sitting right there and there's engagement. If that happens online, I mean, you may see the person, or not see them on their phone below and out of the screen. So, I think the risks are higher there. But if you practice and just engage it, I think there's so many resources now in this virtual world to be able to communicate and to connect. We're all just hopping on quick Zooms and, doing that all day long. I've already been on, 6 this morning, and it's not even noon here on the West Coast. So we're dealt at this time and we roll with the punches. That said, I feel like it'll allow programs like Stanford, our fellowship program in sports medicine. We are thinking outside the box for ways that we can attract these applicants. We now have a unique platform to show them, perhaps with little tidbits, well-edited videos and clips and different strategies to try to engage them online even before they come here. Maybe they can virtually show up for some of our conferences to get a feel for our didactics. We can certainly, field questions that they may not ask in person. Maybe they'll type out questions in a thoughtful manner, so we'll be able to reach more. So I think for every downside, there might be benefits, and those who take advantage of that and don't feel as if they are now slighted because they're living in this virtual interview world, and it just was really bad luck, and now I just am doomed because of that. That's not the attitude that's going to lead to success anyway.
Can you talk about your involvement with the AOS Sports Medicine Committee and how y'all are helping the next generation?
Yeah, I think I wear different hats as an academic doctor and surgeon, and that's kind of what I love. So, clearly my main hat is my clinical hat, right? So that's where I'm treating patients every single day. I happen to have subspecialty niche in cartilage restoration and patellofemoral, but the day-to-day interactions with patients is why we're all doctors in the first place. But then we have other hats, my team physician hat, for example, a total different set of kind of rules, obligations, expectations, and frankly, a whole different set of challenges. Another hat is my research hat. So we do both clinical and basic science research. So that's engaging with our learners to write papers on our outcomes for patients, or even deep diving into the laboratory to try to investigate the basic mechanisms behind a lot of the problems that we see in the clinic. So translational medicine. And then, I think the other hat is really leadership service and education. And that's kind of the one that you're talking about. A lot of us in academics, and frankly, some in the private sector, can volunteer for different committees on all of our major national and international organizations. The AOS is our largest national organization. I've been fortunate to be able to rise through the committee process to being the leader of the sports medicine committee. That sounds fine. It's a lot of work, and they usually give that to the younger up-and-comers. So we put a ton of work and effort. Basically, what our committee is tasked with is trying to sort through the variety of abstracts, so clinical and basic science research coming in from around the world, and to put together a program for the national meeting every year based on the best available evidence and what the hot topics are. So I have a huge committee. I think it's 20 plus people on my committee sorting through what is hundreds or even thousands of abstracts. And then I slot them, which is actually a lot of fun. So you can create the program in your mind and then break it and then see it to fruition either in person or virtually. That said, there are other organizations where I'm on committees that have a little different flavor. For example, the Orthopaedic Learning Center Committee for the Arthroscopy Association, the Publication Committee for AOSSM, also taking part in some of the international committees for ISACAS, as well, the Knee Joint Preservation Committee. I think with any of these, you expand your Venn diagram, your network of incredible people who have similar interests from around the country and around the world. It allows you to engage and to give back. It's really rewarding. For me, every day, I wear these different hats on purpose, so it's always challenging and stimulating. And I think, as we said once before, if you're not looking forward to Mondays, then you're in the wrong field and you need to make a shift and a change. You should always be looking forward to the week ahead, and we should always be striving for more. And I think if you find that kind of a job and that kind of position that challenges you, then I think that'll lead to happiness, not just, but frankly, happiness, I think, in a well-balanced life and with your family, which is by far and away the most important. If I can end on one thing for this question, a happy wife is a happy life. And we all sometimes don't learn that early enough. We learn it the hard way. My wife now is a bigger advocate for herself and our family. So she has created her own red lines that I need to adhere to so that we can make sure that things stay in balance as I continue to pursue academic excellence. Things are right on the home front.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.